Have you ever seen a commercial about prescription medication and was overwhelmed or even horrified by the side effects? Hi, my name is Mary Berry, and today I'm here to persuade you that prescription medication side effects are way worse than the side effects of medical marijuana. Since I was a kid, I've always been sickly. I hated going to the doctors because they would always find something wrong with me and they would always prescribe me new medication. My conditions are autoimmune disorder, fibromyalgia, migraines that consist of stroke activity, and post-traumatic stress disorder. There has been a lot of trial and error with medication, and with that came bad side effects, some even long-lasting, like the pain and the weakness on the right side of my body. I constantly have to get my liver and kidneys checked because some of the medication can affect them. Prescription medication cause damage to your internal organs and long-term damage, unlike medical marijuana. First, I will discuss the effects of prescription medication. Then I will discuss the medical marijuana and its effects. And finally, I will discuss the benefits of medical marijuana versus prescription medication. Drugs approved by the U.S. Food and Drug Administration, the FDA, for the sale in the United States must be safe and effective. Therefore, the benefit must be greater than the unknown risks. And this came from the FDA site. Side effects of prescription medication can cause a variety of problems, starting with minor runny nose or cold to life-threatening events such as a heart attack, a stroke, or even liver damage. Doctors at times prescribe medication that's not supposed to go together, like certain class medications like C and D medications that could intensify side effects. For example, like my fibromyalgia, I've been prescribed Lyrica, which is a Class D medication, which is also a narcotic, along with other Class D medications, which almost cause damage to my kidneys. Before Lyrica, I was on another nerve medication called gabapentin that intensified my symptoms and my pain. Doctors sometimes must prescribe multiple medications for multiple issues or misdiagnosis or provide a wrong treatment. And this can also lead to body damage. Currently, opiates are the most prescribed drug for both acute and chronic pain, accounting for approximately 259 million prescriptions. Prescribing opioids place patients at risk of misuse, addiction, overdose. The overprescribed prescriptions and increasing ability of the opioids had drove the opioid epidemic in the United States. And due to the epidemic, it's critical to find an alternative treatment. Now that I just informed you on the effects of prescription medication, let's discuss medical marijuana and its effects. The side effects of cannabis is more manageable and much milder than the effects that you would get from certain prescription medications. Medical marijuana is a flexible medication poised to help with various side effects that range from medical disorders like glaucoma, cancer, multiple sclerosis, PTSD, and more. Medical marijuana side effects consist of red eyes, experiencing anxiety, paranoia, fatigue, among other mild reactions. Most reactions can be reduced in many ways. Well, patients with severe pain don't have many options when it comes to strong painkillers. So they're forced to have opioids like Percocets and things like that cause organ damage or tolerance and addiction. Medical marijuana works for a safe replacement of the opioids without the risk of overdosing. Matter of fact, overdosing is highly unlikely with marijuana because you would need to consume about 1,500 pounds in 15 minutes. And that came from the medical marijuana doctors. Studies show specific factors increase your experience of anxiety or paranoia, such as personality, genetics, or already have the disorder of anxiety. But by using low THC or high CBD strands would reduce or even prevent the anxiety or the paranoia events. Now that I have discussed the medical marijuana and its effects, let's discuss the benefit of medical marijuana versus prescription medication. Medical marijuana address conditions for seniors that suffer from things such as Alzheimer's, dementia, chronic pains, arthritis, glaucoma, and other ailments that many elderly people suffer from. Medical marijuana is easy to adjust its dosage. It comes in a variety of forms. It takes multiple prescription pills just for all different types of symptoms, and that becomes costly and expensive, and you constantly have to run to the pharmacy. But medical marijuana can address many ailments at one time. Prescription drugs typically come in a few forms and doesn't always have alternative options available, unlike cannabis, which consumed in many different ways, like some people oils or edibles or things like that. So today we discussed the effects of prescription medication. Then we discussed medical marijuana and its effects. And finally, the benefits of medical marijuana versus prescription medication. The side effects of prescription medication, such as Percocet, are far worse than the side effect of medical marijuana. The effects of prescription medication outweighs the effects of medical marijuana. Since the use of medical marijuana, I've personally been able to discontinue many prescriptions, and I'm able to walk and have less pain, and I don't have to worry about my internal organs as much being damaged and adding more prescription medications. And I went from a Ziploc bag or grocery bag full of medication to only 5 different medications. So it works. Well, thank you for your time.